Most people still believe a heart attack makes an announcement. A crushing pain in the chest. A hand pressed against the left arm. A sudden collapse to the floor. That is what films have taught people to expect. That is the picture most families carry in their minds. But after the age of 60, some of the most dangerous heart events do not arrive like that at all. They arrive quietly. They build in silence. They begin while the house is dark, while the phone is on the nightstand, while everyone believes the night is harmless. No dramatic warning. No time to react. No second chance. And what shocks many of my patients most is this: the event itself may happen during sleep, but the trigger often begins hours earlier, with something small, ordinary, and forgettable. Something done almost automatically before turning off the light. I have spent more than 2 decades in operating rooms opening chests, repairing blocked arteries, restoring blood flow, and holding failing hearts in my hands. And across all those years, one pattern has repeated itself again and again. Not rare diseases. Not mysterious causes. Patterns. Simple nightly habits that people never imagined could place so much strain on the heart. Habits that feel normal. Habits that feel harmless. Habits that, repeated night after night, quietly prepare the body for a crisis it never sees coming. Tonight, I want to show you 5 of those habits. 5 quiet mistakes that can place the aging heart under dangerous stress while you sleep. And more importantly, I want to show you how to reverse them with simple evening choices that may protect your heart far more than you realize. Stay with me, because what you are about to hear may change the way you think about your nights for the rest of your life. Here is the first thing you need to understand. Your heart does not rest at night in the way most people think. It does not switch off. It does not stop working. It changes rhythm. In a healthy body, nighttime is when the cardiovascular system shifts into a protective mode. Blood pressure should gently fall. Heart rate should slow down. Blood vessels should relax. The body uses those hours to repair, regulate, and recover. That natural drop matters. It is one of the ways your body protects your arteries from continuous strain. But after 60, that protective rhythm often becomes less dependable. Blood vessels lose flexibility. Pressure control becomes less precise. Hormonal signals that once helped the body regulate itself overnight begin to weaken. The margin for error becomes smaller than most people realize. During the day, your body has more room to compensate. You are awake. You are moving. Your systems are active and responsive. But at night, many of those protective mechanisms are reduced. Your body is operating in a quieter, more vulnerable state. And that is exactly why the overnight hours can be so dangerous. The risk is not always when you are busy, stressed, or rushing around. Sometimes the risk is highest when everything appears calm. Between midnight and the early morning hours, the aging heart is often at its most exposed. And what happens during those hours is deeply influenced by what you did before bed. What you ate. What you drank. What medication you took, or forgot to take. How you slept. Even the temperature of the room around you. These are not dramatic decisions. That is why they are so easy to ignore. But for the heart after 60, these details matter far more than most people have ever been told. So let me ask you something very simple. What time did you eat dinner last night? And what exactly did you eat? Because when I ask older patients that question, I hear the same answer over and over again. Late. 8 o'clock. 9 o'clock. Sometimes even later. A large plate of rice, pasta, bread, meat, fried food, something heavy and filling, followed by television, a chair, a sofa, and bed not long after. I understand why it happens. Days get busy. Family schedules drift late. People get hungry in the evening. Habits built over decades feel natural. But from the heart's perspective, a heavy late dinner can be one of the most underestimated forms of nighttime stress. When you eat a large meal, your body has work to do immediately. Digestion demands energy. Blood flow shifts toward the digestive system. The heart must pump harder to support that process. Blood pressure can rise. Blood fats increase after eating. The entire body becomes more metabolically active at the exact time it should be preparing to slow down. So now you have 2 competing demands happening at once. Your body is trying to enter nighttime recovery mode. But your digestive system is forcing your heart to stay busy. That conflict matters. And after 60, when arteries are often stiffer and cardiovascular reserve is lower, that mismatch can become far more than just discomfort. For some people it means reflux, poor sleep, nighttime pressure elevation, and extra strain on an already aging heart. For others, it can contribute to the kind of internal stress that sets the stage for a more serious event before sunrise. This is why I tell patients something very simple. Do not let your biggest meal of the day become your heart's last burden before sleep. If possible, finish your main meal by 6 o'clock or 7 o'clock in the evening. Give your body time to digest before bed. And if you must eat later, make it lighter. Lean protein. Vegetables. Smaller portions. Less grease. Less heaviness. Less work for the heart. That one change sounds small. It is not small. It may be one of the easiest ways to reduce unnecessary nighttime cardiovascular strain. Now I want you to pay very close attention to the next habit, because this is where many people unknowingly leave themselves unprotected. If you are over 60 and you take blood pressure medication, timing matters. And for many patients, it matters far more than they were ever told. Most people understand blood pressure as a daytime issue. They think about it while walking around, while feeling stressed, while sitting in a doctor's office. But blood pressure has a rhythm. Or at least, it should. Normally, it rises in the morning, moves through the day, and falls during the night. That nighttime dip is part of healthy regulation. The problem is that many older adults, especially those with hypertension, do not experience that normal drop. Some remain elevated overnight. Some even experience dangerous early morning surges. And when pressure stays high while the body sleeps, the arteries do not handle that stress well. A pressure spike at 3 o'clock in the morning is not the same as a pressure spike in the middle of an active afternoon. At night, your cardiovascular system is more vulnerable. A fragile plaque can rupture. A clot can form. A blocked artery can suddenly become a catastrophe. This is why missed medication matters. And this is why poorly timed medication can matter too. If your blood pressure pill is taken in a way that leaves you less protected during the night, you may be uncovered during the very hours your heart needs stability most. Let me be absolutely clear here. Do not change your medication schedule on your own. But do have this conversation with your physician. Ask directly, should I be taking this medication in the evening instead of the morning? That is not a minor question. That is a serious heart protection question. A 2-minute conversation could lead to a change that better protects you during the night. And far too many people over 60 have never asked it. They assume taking the pill is enough. Sometimes it is. Sometimes the timing matters just as much as the medication itself. And when it comes to the heart, timing can be the difference between coverage and vulnerability. Now let's talk about something millions of people joke about. And I do not. Snoring. Maybe your spouse snores. Maybe someone has told you that you snore so loudly it can be heard from another room. Maybe you wake up tired every morning and think that is just part of getting older. Maybe in the middle of the night, you wake up suddenly dry-mouthed, unsettled, or gasping slightly, then go right back to sleep and forget it by breakfast. For many people, those signs are brushed off. They should not be. Because behind loud, irregular snoring there may be something far more serious than noise. There may be sleep apnea. And after 60, sleep apnea can become a major hidden stressor on the heart. During an apnea episode, breathing stops for moments at a time. Sometimes brief. Sometimes much longer than people realize. Oxygen levels fall. The brain senses danger and sounds an internal alarm. Stress hormones surge. Blood pressure jumps. Heart rate changes abruptly. The body is repeatedly thrown into a cycle of silent distress. And this does not happen once. It can happen again and again and again throughout the night. While the person sleeping often has no idea it is occurring. Imagine what that means for the heart. Repeated drops in oxygen. Repeated surges in pressure. Repeated hormonal alarms. Night after night. Month after month. Year after year. This is not subtle. It can contribute to irregular heart rhythms. It can worsen blood pressure control. It can increase cardiovascular stress in ways that are easy to miss until the consequences become serious. And that is why I say this very directly. If you are over 60 and you snore heavily or wake up exhausted, or someone has ever told you that you stop breathing during sleep, you should not ignore it. You should get evaluated. Not someday. Not when life gets less busy. Not after another 6 months of fatigue. You should bring it up with your doctor. Because untreated sleep apnea does not just disturb sleep. It can quietly punish the heart every single night. And here is what makes it more tragic. Once it is recognized, it can often be treated. Yes, devices like CPAP can take adjustment. Yes, some people resist them at first. But many patients who use proper treatment sleep better, feel better, and reduce the nightly stress their cardiovascular system has been enduring for years. If your body is fighting for oxygen all night, your heart is paying the price. Please do not dismiss snoring as harmless background noise. Sometimes it is the sound of a problem asking to be noticed. Now let me give you another habit that sounds reasonable, logical, even sensible, but can still create risk. Many people over 60 deliberately stop drinking water in the evening. They do it for understandable reasons. They do not want to wake up at 2 o'clock in the morning to use the bathroom. They want uninterrupted sleep. They want to avoid getting out of bed in the dark. They want to reduce the risk of falls. All of that makes sense. But there is a downside many people never consider. Going to bed slightly dehydrated can place unnecessary stress on the cardiovascular system. When the body is low on fluids, blood volume and circulation dynamics change. Blood can become relatively more concentrated. Flow becomes less efficient. For a young, healthy system that may be tolerated easily. For an older body with narrowed arteries, vascular stiffness, or underlying plaque, that is a different story. Now add sleep to the equation. You are lying still for hours. Heart rate slows. Circulation is naturally quieter. Movement is minimal. If hydration is poor, you are creating conditions that are less favorable for smooth, efficient blood flow during the very hours when the body is most still and most vulnerable. This is why I encourage something simple rather than extreme. Do not flood your body with fluids right before bed. But do not dry yourself out either. A modest glass of water in the evening is often a far better choice than going to sleep dehydrated. And if you wake up thirsty during the night, pay attention to that signal. Your body is not bothering you without reason. Sometimes it is telling you something important. You do not need to choose between protecting your sleep and protecting your heart. The goal is balance. Enough hydration to support circulation. Not so much that sleep is constantly interrupted. Simple. Practical. Effective. Now let us move to a factor almost nobody connects to cardiovascular health, even though it affects the body every single night. Bedroom temperature. Most people set their room based on habit, season, or personal comfort. They think in terms of blankets, fans, air conditioning, and preference. But temperature affects the heart more than people realize. If the room is too warm, the body works to release heat. Blood vessels change. Sweating increases. Fluid loss rises. Heart rate can stay slightly more elevated. Deep sleep can suffer. And when sleep quality suffers, the body loses some of the recovery it depends on overnight. If the room is too cold, a different problem appears. Blood vessels constrict. Blood pressure can rise. The heart must push against greater resistance. For someone with hypertension or coronary artery disease, that added strain is not something to dismiss. The body sleeps best, and the cardiovascular system tends to function more calmly, in a moderate temperature range. Not hot. Not cold. Stable. Comfortable. Supportive of deep, restorative sleep. Because that deep restorative sleep is not a luxury. It is part of the maintenance system your heart depends on. And when you repeatedly disrupt it with an overheated room, excessive sweating, chill-induced constriction, or poor sleep quality, you are not just affecting comfort. You may be affecting recovery. That is why even your thermostat can become part of your heart routine. Think about that for a moment. Dinner timing. Medication timing. Breathing during sleep. Hydration. Room temperature. None of these sound dramatic on their own. That is exactly why they are missed. But when those small habits stack together, night after night, they create either protection or pressure. And now I want to show you what protection can actually look like in real life. Not a perfect life. Not a strict life. A practical life. A heart-safe evening routine. Imagine this. Your main dinner is finished by around 6:30 or 7 o'clock. It is satisfying but not overloaded. Enough food to nourish you, not so much that your heart has to work overtime digesting it while you sleep. Later in the evening, you take a moment to think about your medications. Not casually. Not automatically. Intentionally. If you are on blood pressure treatment, you make sure you understand the plan your doctor has set for you. You stop assuming timing does not matter. You keep the evening calm. Less screen glare. Less stimulation. Less late-night eating. Less stress. A quiet walk. A book. Gentle conversation. A slower nervous system. Before bed, you make sure the room is comfortable. Not stuffy. Not cold. Just right for good sleep. You place water nearby. If snoring has been an issue, you stop pretending it is harmless and start treating it as the health signal it may actually be. If sleeping on your back makes it worse, you shift to your side when possible. These are not dramatic changes. But dramatic change is not the goal. Consistency is. Because the heart rarely breaks down because of one night. It is worn down by patterns. And it is protected by patterns too. That is the part one wish more people understood sooner. Now let me speak to you very honestly. Not as a narrator. Not as a content creator. As a surgeon. I have seen what happens when a preventable night turns into an irreversible morning. I have seen families arrive at hospitals confused, frightened, and completely blindsided. I have seen people who looked stable just days earlier become emergency cases before sunrise. And in far too many of those situations, the warning signs were there. They were simply not recognized for what they were. A heavy late meal dismissed as normal. A missed pill treated as unimportant. Snoring laughed off for years. A dehydrated body trying to make it through the night. A room environment that quietly worked against recovery instead of supporting it. These things are easy to ignore because they are woven into ordinary life. But ordinary life is exactly where risk builds. That is the truth. Most people do not lose heart health overnight because of one mysterious moment of bad luck. Very often, they lose it gradually through information they never received, and habits they never knew mattered. Now you do know. And once you know, tonight becomes important. Not next month. Not after some future resolution. Tonight. So before this day ends, I want you to remember these 5 things. Finish dinner earlier whenever you can, and do not make your heaviest meal the last burden your heart carries into the night. Speak with your doctor about your blood pressure medication timing if you take it, because protection during sleep may matter more than you realize. Do not ignore snoring, choking sensations, morning exhaustion, or signs that suggest sleep apnea. Do not send yourself to bed dehydrated just to avoid one trip to the bathroom. And create a sleep environment that actually helps your heart recover instead of forcing it to struggle in silence. If even 2 of these habits sound familiar, you are not alone. In fact, that is exactly why this message matters. Because many people over 60 are doing these things every night without ever connecting them to heart risk. And if that is you, this is not a reason to panic. It is a reason to act. Quietly. Wisely. Starting now. And if this message helped you, then do one more thing that could genuinely matter. Share it with someone older than 60 that you care about. A parent. A spouse. A brother. A sister. A friend. Someone who may still believe that if a heart attack were coming, it would announce itself loudly enough to be noticed. Sometimes it does not. Sometimes the danger whispers first. And that is why these conversations matter. Your heart has worked for you every minute of every day, and every minute of every night, for your entire life. Take care of it with the same faithfulness. Give it a calmer evening. Give it better conditions. Give it the kind of night that helps it keep beating strong for years to come. And one final word from Dr. Anthony Fauci. Everything shared here is for general educational purposes and should not replace personal medical advice, diagnosis, or treatment. If you take blood pressure medication, have symptoms such as snoring, choking during sleep, morning fatigue, chest discomfort, or any concern about your heart, please speak with your own doctor. Do not change medications on your own without professional guidance. I'm Dr. Anthony Fauci, and I sincerely hope you will still be here, healthy and strong many years from now. Good night. Sleep well. And starting tonight, take better care of your heart.